So good evening, everyone.
Good
Thank you
evening.
for being here at the Survivors Slimdown workshop. The name of this workshop is Oral Health, the Window of Our Overall Health. My name is Patty Murillo Casa. Just to tell you a little bit about me, I'm a registered wellness and health coach by the Health Coach Alliance. I am also a fitness instructor. I am a 15-year cervical cancer survivor, a survivor ambassador, and I am a retired New York City police officer who still resides here in New York. And I also lead Survivor Slimdown. Survivor Slimdown, powered by Survivor, is an online community for all cancer survivors to support each other and live a healthy lifestyle. We believe that maintaining a healthy lifestyle can help cancer survivors reduce the risk of recurrence and support the overall well-being. Without any further ado, let me introduce you to the amazing panel I have here. We have Carla Chavez, our moderator. Hi, Carla. Uh, she's from Honduras, Central America. So this workshop just became international. Carla is a civil engineer and 7 year cervical and thyroid cancer survivor, and a very proud estimate. Yes. She is a survivor ambassador and she co-leads the Survivor Espanol community. We also have Myra Segui. Myra graduated from hygiene school in 1989. She worked in private practice for 35 years between New York City and Westchester County. We also welcome Rose Maniscalco Ornes. Rose graduated from hygiene school and graduated for hygiene school in 1981. She had worked in private practice for over 40 years in Long Island, Queens, and New York City. Rose is also a uterine cancer survivor. Thank you both for being here and for sharing your knowledge and expertise with all of us. At the end of the presentation, you are going to be able to ask questions to Rose and Myra in real time and just by raising the hands in the little thing, right? Carla have a few questions that were sent prior to this presentation and we'll ask at the end of the presentation. Finally, and yet more importantly, we have two prizes to raffle, and Carla will do that for us. So I thank you. And Carla, you got the floor. Rose and Myra, welcome.
Welcome, everybody. I'm happy to be here with you. I'm happy that Rose and Myra gave us their time also to educate us, which is very important about our oral hygiene. So let's get started. Let's see, who wants to go first and tell us a little bit about their story and about oral hygiene and how they got into that field before we start with questions?
Go ahead, Rose.
Rose.
Okay. Hi, my name is Rose Maniscalco Ornez, and I love dental hygiene. I really enjoy what I do. I love educating my patients and everyone in between. I really think it's very, very important for your oral health to be pristine because it can lead to so many other different complications in our bodies. I am, as Patty had mentioned, I am a uterine cancer survivor, 10 years, although I am still in active current treatment. And I'd like to speak about today some of the mouth sores that we can get from our oral chemotherapy. And I can hit on that right now if everyone likes. It's really important that before we start cancer treatment, it impacts our teeth and our mouth so much. We should really try to go to the dentist first, just so they can check to make sure there's no active infections and just to get a really good dental cleaning by a dental hygienist, because that's all we do. We clean teeth day in and day out. And we leave no stone unturned when it comes to getting in there and getting what we need to get. But in any case, having a clean bill of health first before starting any type of either oral chemotherapy or infusion is so helpful because so many things can pop up during the course of our treatments in chemotherapy. Chemotherapy can give us dry mouth sores, brittle teeth, which I have experienced each and every one of them. And as I had mentioned to Patty before, some of the oral chemotherapy medication can bring light to oral sores, either on our tongue, on our cheeks. And I was in a blog a few weeks ago, and someone had mentioned the empty pill capsules that sort of look like this. They're clear, these are size 0. And I have been putting my oral chemotherapy inside these pill capsules and taking it. And for the past 2 weeks, I have not experienced any mouth sores. And that is huge because for the past 2 years, I have had mouth sores, tongue sores in my mouth multiple times. And, when you have mouth sores, it really impacts your life. You can't eat well and drink well, and it affects your quality of life. So there are certain things that you can do for the mouth sores. Either the oncologist will give you a salve, some type of paste called Kenalog paste, which we use in dentistry as well. It sort of puts on, it's almost like a oral Band-Aid. We also can use a tincture of myrrh, which is a tincture is alcohol and water based, and myrrh is derived from from a plant. It's been used in medicine for hundreds of years. And we use that in dentistry as well to put on top of mouth sores. And it does quicken the process of eliminating them. But yeah, just before, we can start our chemotherapy, it's always good to go to the dentist just to make sure everything is perfect in our mouth, whether we have dentures that need to be refitted or anything.
Crowns being checked, implants, everything.
Decay.
You go in, you get an exam, you get x-rays, you get your cleaning, all of it before you start your treatments.
Oh, that's interesting. That was one of the questions that was sent in to the group. About these treatments, before you go into treatment, I, for example, had radioactive iodine. I had to take it, and I know that the damage to the teeth was enormous. What would you recommend a patient go and ask their doctor prior to these treatments? What should they know?
They should tell the doctor what type of, like the radioactive iodine. Maybe there's something that the dentist can recommend prior to that. It's always good to ask as many people as possible. Since you knew the medication that you were going to have, always question them. I mean, even with the radioactive iodine, they give you, I'm sure, pages upon pages of side effects that can happen. And, teeth become brittle for certain, cancer treatments. And, you could bite down wrong and break off a tooth. And that happens all the time.
Thank you. Myra, would you like to add anything else?
Yeah, when Rose said that there's things that can be done, I've also heard of dentists making trays, custom-made trays for some of the patients, and they can put like a fluoride inside the tray and sleep with it to help prevent the decalcification and some of the patients are throwing up and there's a lot of acidity in the mouth. All that attacks the enamel of the teeth. So if you have the trays sitting there overnight, you're preventing the decay. You're preventing
the acid erosion.
and erosions, and you're let's say you're starting some decalcification of the enamel, this also can help prevent the decalcification of the enamel.
Interesting. Thank you. And what long-term effects should a cancer patient be aware of after treatment, for example?
There's so many different things. Sensitivity of the teeth due to the different types of medications that are prescribed to us. Dry mouth is ongoing for many patients. Teeth becoming brittle and breaking. That's always a factor. And even that actually, once it happens, you have to, sometimes some of the medication needs to be stopped before you can visit the dentist. Because there was one medication that I was on where I had to stop it 2 weeks before I had any dental work done.
Wow.
So that really prolonged the whole entire procedure. And then it was only until after maybe a month or so, then I had to restart the medication that I was on.
Yeah. I also experienced some bone loss in my jaw. So that happens too.
Yes,
Yeah.
it does.
Yeah.
The gums can become sore. I mean, the oral tissues really take on a different change with certain medications that we're on. And it doesn't go away anytime soon, I should say. And that can last for years.
Wow.
I know that dry mouth can last a long time. And there's a lot of different ways of dealing with the dry mouth. There's, substitute salivas that the doctors or the oncologists can prescribe you, or there's some people don't like the taste of those things. There's things that coconut oil. There's a lot of different things to help manage you. However, is it what we're used to? We're used to saliva. It's not saliva, so it's not gonna be what you want and what you're used to. However, you have to try to make it work for you somehow.
Yeah, that's very true.
And
Very
if
true.
you go into the dentist and see your hygienist and your dentist, they can give you these little ideas for you to try, and you stick to the one that works the best for you.
That's right.
So making these visits to the dentist is very important. Very important.
You have to pick their brain
Yeah, I can
to
say I'm
try
trying
and
to pick
see
yours.
what's going to work for me. Absolutely.
You try them all. You try every idea that's
Sure.
thrown at you, and you stick to the one that works for you.
Now, talking about the future, about these ideas and picking their doctor's brain, I'm trying to pick yours a lot. Can you like come through oral health after treatment? Like, can you rebuild your oral health, or will we be experimenting the dry mouth, for example, or anything else in the future? Is it a possibility to rebuild it?
There's always a possibility of rebuilding. Never think it's a lost cause on, oh, why should I go back to the dentist? There's nothing that they can do. There's always something to be done. There are new breakthroughs in dentistry as
All
well
the
as
time.
anything else. And there's always something that can be done. It may not be a permanent situation or a permanent solution, but there's always something that can be done, even if it's temporary. We start off small and work our way up.
Agreed.
When I have this question that has been bugging me too that day, what daily oral hygiene routine do you recommend for cancer survivors?
You go, Rose.
Okay. Start off proper brushing at least twice a day with a fluoridated toothpaste, and flossing. Flossing will be your saving grace. Just getting that string in between each and every tooth and in back of the last tooth to get all that plaque and bacteria off, to start with a nice clean slate. Dental checkups at least twice a year, very important, and a cleaning with the dental hygienist. Change your toothbrush regularly, every 3 months, or when you start to see it splay out of shape. If you see it splay out of shape sooner than 3 months, then you're scrubbing a little too hard. Plaque is a very soft, sticky substance, and all you have to do is touch it on your tooth and you remove it. You don't have to get in there and scrub like you're washing your car or scrubbing the floor. It's very soft and sticky. It will remove very easily. So you don't have to have a death grip on the toothbrush. Nice and easily, gentle. And we could also try eating foods that clean teeth, crunchy fruits and vegetables. An apple is a natural toothbrush. Raw broccoli, raw cauliflower, carrots, they all will scrape our teeth and remove plaque from them. And they're healthy to eat.
I did not know
Agreed.
that.
Yeah.
These are great tips.
What about the toothbrush? Does they come soft, medium, hard? Which is recommended?
Always soft. And
Okay.
because we're adults, we don't need a toothbrush head that's gigantic, because the more compact the toothbrush is, the better that we will have maneuvering it to the front and the back portions of our mouth. It's very important to be able to reach our last teeth in the back. And once you brush everything and you feel with your tongue, each and every surface should feel perfectly smooth. And if it doesn't, get back in there and brush again. Again, brushing gently, not getting in there with a death grip and scrubbing.
Slow
A lot of
and
people have
gentle.
Yes, a lot of people have a misconception that they need to get in there and scrub. It feels better. We all do it. We're all guilty of doing that, but it's not the proper way.
Nope.
Now, do you recommend electric brush versus regular brush?
I use both. When I was in active treatment and with those mouth sores, the electric toothbrush was very harsh and I couldn't use it. I actually had to find an ultra soft toothbrush and use that because my gums were they weren't inflamed, but they burned. And it was such an awful feeling. I mean, everything I ate or drank really just impacted my mouth so terribly. So the ultra soft toothbrush, or even a child's toothbrush, just felt, good in there, just to remove the plaque from your teeth.
Oh, that's interesting.
Mm.
I always go very hard on it. Now I'm going to change that.
Yeah.
Yes.
I'm definitely going to change that.
Once you wear away the enamel, it's gone.
doesn't grow
We can't
back.
get that back.
It does not come back. And
No.
people can brush so hard that they brush their gums away as well. That will not grow back. What you've lost, you've lost.
Mm-hmm.
Oh, wow. Okay. I was just going to ask about gums.
Slow and gentle.
Slow and gentle.
Plaque is a sticky, slimy film that we produce 24 hours a day. No matter what we eat, no matter what we do, our bodies are going to produce it. Just like pee and poop and sweat, our bodies are going to produce it. And it only needs to be disturbed. So if you floss it away with a little piece of floss, if you brush it away gently with a soft toothbrush, that's all you need. Just be thorough, slow and gentle.
Awesome. I find this amazing. Learning a lot from you both. I know that we get when we age, we're going to start experimenting different things, but sometimes cancer gets into our lives and everything. Does cancer treatment make us more prone to gum disease or infections?
It does not. It
Okay.
does not make us prone to gum disease. It can make us prone to infections if
Mhm.
we have sores in our mouth, but we're not more prone to gum disease because of the of our past medications that we're on. As long as we start off with a clean mouth
Mhm.
and healthy gums, the gums have to be healthy to begin with. If you go in to this with unhealthy gums, it's just going to exacerbate from there.
Okay, since you did mention infections, what should I watch out for when?
Sores that won't heal
Mhm.
or in there for a few weeks and won't go away no matter what you do, then address it to either your doctor or a dentist.
Okay. That's excellent. We do have questions that were sent to us previously, so I'm gonna go ahead. Well, you already explained what is the best way to brush when we have our teeth, but you did mention fluoride toothpaste. Would you recommend any other types of toothpaste or anything that we should be using?
What I did when I had the mouth sores they were open and even brushing would hurt. I bought a child's toothpaste, not a mint. It wasn't mint flavored because the mint would burn someone that has open mouth sores. A child's toothbrush, or even just dipping the toothbrush in water and brushing.
Okay.
Yeah, they're all helpful, but not a non-mint toothpaste would be helpful for someone that has open sores in their mouth also.
And how about addressing bad breath? Because is there anything we can do?
There's so many different reasons why we could be experiencing bad breath. I mean, there could be dry mouth, that'll give you bad breath. It could be coming from your tonsils. Some people have tonsil stones in their tonsils. That has a very strong odor. But that you would know if you went to the dentist and they looked in your throat when they're giving you your oral cancer screening. They'll look at your throat and they tell you, oh, look, you have some tonsil stones back there. A lot of people take them out themselves if they're manageable with a Q-tip.
Right.
They're able to get them out. There's lots of videos online that people can look this stuff up. All tonsil stones, very interesting stuff. There's also people that don't floss. They will have an odor in their mouths. People that are bleeding, their gums are bleeding, they will have a bad taste and a bad smell in their mouths. It all comes down to getting your teeth checked and all the work you do for yourself at home. The more you do for yourself at home, the less there is to be done at the dental office. So if you hate going to the dentist, then take care of it yourself as much as you can at home. That doesn't mean that you should not go to the dentist. You should go to the dentist at the very least twice a year.
Sometimes we actually put that screening to a side.
Everyone does. Everyone
Yvette,
does.
Yvette asked in the chat, are you screened automatically for oral cancer when you go to a dentist for an exam, or do you have to request it?
You should never have to request it. We always do it, but I do know offices that do not do it. And either their dental hygienist or the dentist should do it. If it's not done, they should certainly be requested.
Yes, then you should bring it up for yourself.
Yes.
You ask, did I have an oral cancer screening? Was I checked for oral cancer? If you're not sure that they did it for you, then definitely ask.
Okay, that's a good. I have another one about why are my teeth so sensitive to cold or hot foods?
You want to take it or me?
I'll take it. As we age, sometimes our enamel gets thinner and we're much more sensitive to hot, cold, sweet, sour, different things like that. There are recommendations for different types of toothpaste, Sensodyne being one of them. Sensodyne has a sodium fluoride, it has fluoride, it also has potassium nitrate in it, and that's a desensitizer. If used correctly, that Sensodyne can desensitize those teeth, making it tolerable to have hot, cold, sweet, sour, and different things like that. But it has to be used over a period of time.
Yeah, within 2 weeks, you should feel some
Usually,
relief.
yes.
Usually.
There's always something that can be done. And if there's still unknown sensitivity, always check with a dentist. Maybe there's some underlying problem somewhere.
Okay. I like this one. This one was said, what are my options for whitening my teeth?
Well, there's a lot of different options. But what I normally do with my patients is I tell them to try something over the counter, like the Crest White Strips. I'm
Right.
not gonna recommend something that I've never tried. If I'm gonna recommend something, I'm gonna recommend something that I've already sampled. And the beauty of these strips is that the box will tell you to use it for 7 days straight. However, some people are a little sensitive. So the beauty of this is that you can miss a day in between to let your teeth, you're not going to get the results you want as fast, but you can take a day in between of wearing the strips. Now, the box might tell you, you should wear the strips for 45 minutes. And if you're still sensitive, you're still feeling sensitive after trying the 45 minutes, then the next time you do it, you cut it back to maybe 30 minutes. Again, you're not going to get the results you want as fast, but come on, you're sensitive, So you make it work for yourself. Now, if you can do those over the counter things with no kind of sensitivity, no issues, and if you want to try and do one of the in-office procedures, then you can do that. Mind you, they're much more expensive. And the chances of having sensitivity to one of those in-office type whitening procedures, the chances of sensitivity will be greater because it's much more stronger. So starting off with an over-the-counter product would probably be gentler.
That's great. Tamika said that she wanted her teeth super white like chiclets. Me too. I just can't seem to get it there, but now I know.
I have a question. Waterpick versus dental floss.
No,
Always
they don't.
floss.
They don't
There's
verse each
no
other. There's no
comparison.
verses.
Oh, okay.
It's
Okay.
not verses. No, you have to always floss. The toothbrush does not fit in between the teeth.
That's right.
Water picking is beautiful for going on the bridges, for going on the implants, for spaces in between the teeth. It'll flush food and bacteria out. However, the floss is what gives you the friction you need. I like to use this analogy. You have a plate, you just finished eating. Let's say there's some gravy on it. If you were to put that plate under a running faucet, does it clean the plate? No. You literally have to come with the washcloth and put the friction over the plate, and then the plate is nice and clean. Well, that's the same thing with the floss. You have to get the floss against the tooth, and you have to go up
disturb
and
that
down.
bacteria.
You have to disturb the plaque. Both sides, every space. You have to, don't be afraid to dip it gently under the gum line.
That's
and
right.
bring all that bacteria up. You have to do both.
Wow.
That will save your teeth.
And problems.
Flossing. I need to do better at that.
And the way to make it easier is by leaving the floss, I find, by your favorite chair, the place you hang out the most in the house, center console of the car, while you're waiting for parking, waiting for your husband to come out, waiting for your mother, your kid, whatever. You grab your floss. If you see it there, you'll
You'll
say, "Oh
use it.
wow, let me get this
Yep.
done now before I forget or get too busy and I wind up going to sleep without flossing." As
No.
long as you disturb it every day, you'll have a healthier mouth.
Point taken. Okay. I have a question here. It says, why are my gums bleeding when I brush, and what can I do to prevent it?
Well, as long as you've been to a dentist just to make sure all the tartar is away from the gums and you're using a soft bristle toothbrush. A lot of people, if they get in there and they scrub very heavily with a medium or a hard toothbrush, their gums will bleed, even if they're healthy. You have to get in there gently. But the first thing to do is make sure you get a good dental cleaning by a hygienist just to make sure you're virtually plaque and tartar free. And if they're still bleeding, then there's some type of underlying problem.
Yeah.
Oh, that's great. I want to thank you both. I have no more questions. I don't know if anyone in the chat. Let me check. You guys this has been an awesome talk. I love it.
I tell you, 80 years of experience. You could tell.
You can tell, yeah.
Them 80 years. If anybody has a question, you could raise your hand or unmute yourself and ask Myra or Rose. Don't be shy. We learn from making a questioning. Like no question is dumb or anything like that. We learn from
That's
it.
right.
Yeah. So, anything? Thank you, Yvette, for asking the question. Anything?
I'll ask one. Oh, go ahead, Marcela.
Marcela, mute.
You
You're
mentioned
muted. Yeah.
tonsil stones before, and this year my daughter experienced that, and I'd never heard of them before. What causes them?
Food gets trapped inside the tonsils. The tonsils have these little craters and the food and plaque collect in these little craters, and it sits there, and it gives you really bad breath. If you were to ever get one out and smell it, it smells terrible.
It does.
Is there a way to prevent them, or like gargling, or?
I've never experienced them. My daughter had strep throat when she was a young girl, and she sometimes gets them. And she's tried oral probiotics, and they stopped for a while. And she's tried salt water rinses, but every once in a while she'll get another one.
So it's something she gets.
Yeah.
Right?
Yeah.
Okay. Well, my daughter went to a doctor, and she just popped it out.
Yeah. Sometimes they do surgery. Sometimes because it's such a bad situation with people.
Yeah.
I've heard them doing tonsillectomies, partial tonsillectomy.
Wow. Yeah, I believe it. I have one more question. If if you lose a rear tooth in the upper or lower of your mouth, like the rear, the farthest out, does that misalign your teeth?
Not necessarily. If it doesn't have an opposing tooth underneath it,
Uh-huh.
it may not shift things around. I mean, if it's in between something, then yes. But if it's the very last tooth that we have, maybe like a wisdom tooth, that doesn't necessarily mean things will shift around.
Okay. All right.
And the
That's good.
shifting does take years, though.
Okay. All right. Those are my questions. This has been really informative. I really like this. Thank you.
You're welcome.
Thank you.
Thank you, Marcela.
I have a question. Always with oral health and about losing teeth. I know about certain patients that we've had here in Honduras. I don't know if this is due to maybe our treatments or anything, but cancer patients have been losing teeth while after cancer, like years after, and there's sensitivity, they brittle, what you were saying, they break, but is losing teeth something that we could expect in after treatment?
I guess that it can always be a problem. I mean, it depends on the strength of your teeth prior, going in, before the treatment.
Mhm.
If things are healthy, I guess the outcome will most definitely be healthy. But if you go in with a poor outcome, then there may be crowns or bridges in your future or implants.
Mm. This was amazing. I don't know if anyone else has any other questions or would like to comment. No?
It all boils down to how much and how well you care for yourself every day.
Flossing.
Flossing, yes. Oh, yes. Oh, yeah.
If you have,
Prioritizing your dental health can improve your overall health and well-being. That's the bottom line.
and if you have bridges and crowns and implants, you have to floss under there. That's no excuse. You get a floss threader and you go under those bridges and you get them clean.
There's always a way around it. Always.
Thank you so much. This was very informative. I've learned so much.
Yeah,
Good.
me too.
I have a question.
Oh,
Oh,
go ahead,
okay.
Yvette.
Yvette.
I've always had a hard time with flossing because I get discouraged with the fact that my bottom teeth are very crowded. So I literally like can't get the thread down there. Um and so then it throws me off from not even trying to do the other teeth. So that's always been a struggle for me. Um what do you recommend? I mean, I know they have the flossers with the handles. Are those good enough
Those,
or
those probably would break to try and get in there. They do have dental floss that are made of like Gore-Tex. I think Glide is one of them. It's a Gore-Tex based dental floss, and it can slide in and it won't shred or fray in those areas where it's very tight, where your teeth are very, very tight together. It
Mhm,
can be a challenge to get in there. I
right?
know exactly what you mean, but there are flosses that have they're coated. Some have wax coating on there. Try and get in there with whatever you can, but don't give up.
Don't
There's
give up.
always something that can get in there.
Don't
Don't
give
give
up.
up.
I get
There's
lazy. Thank you.
also tooth picking.
Mm,
You have to disturb the
okay.
plaque every single day. But glide floss should help you with those crowded areas.
Yes.
Okay. Thank you.
It's a very soft,
Mm-hmm.
uh, silky type floss.
Hmm.
Okay.
Like
Yes.
really silky. It's weird how silky it is, but
But
it
it
can
works.
get into those tiny, tight spaces.
Yeah.
It works. Try different flosses.
Okay.
Not every floss is for everyone. Try different ones.
Yeah.
But for that crowding, I would definitely go with Glide.
Yes.
Thank you.
You're welcome. I'm glad you asked.
Don't give up.
That's right. There's always a way.
Yep.
Mm-hmm.
Okay. So
So if there's no any more questions, we could do the raffle, Carla, right?
sure thing. We have 8 participants today, so let me get this done.
Can I just ask one more question?
Oh,
Yes,
sure.
Priscilla, go ahead.
Sorry. Yeah, so I actually work alongside with Suli a lot of times with events. And I feel like for me it's not more like a question of how to floss and how to brush and what to use, but more so for the community that we serve and we try to serve, which is, you know, the Latino community. And the way that they come into the US and flossing and brushing and toothpaste and fluoride, it was never even introduced to some of these people in our community. So, and even I can say that for myself, right? I feel like I'd rather have a pap than have my teeth cleaned. So how can we make, I know, right? That's like the weirdest thing to just feel like I feel more comfortable by doing that than going to a dentist. Um, but as professionals, what do you guys recommend that we even when we talk to our community and we tell them go and you know we give them resources of clinics that we know that are cheaper and you know things like this, but it doesn't matter how cheap, it doesn't matter if it's free, it doesn't matter if they speak the language. If they're afraid, they're afraid. And so trying to break those barriers, it is the hardest thing. I mean, for me, at least for the dentist, it is a very scary place to go. Do you guys encounter that where you guys have patients that feel
Of course we
extremely
do.
afraid? And how do you
No,
ease
we
that?
do.
Every
You know,
single day.
you try and speak to them and make them feel comfortable. Making them feel comfortable is the number one key. You know, tell them that, you know, we're a person just like you, and we
Mhm.
have heard these things day in and day out, that fear is real, and
Yeah.
especially dental fear is
Oh
real.
yeah, yeah. And I feel
Yeah,
like a lot of our community, because I also am a certified medical assistant, and so I can see where a patient is afraid to go and see a provider. But when it comes to dental services, I can always say, oh, the doctor has seen worse things, right? Like they've seen everything.
of
But in
course.
the dental field, it's just so invasive and people feel so judged and um even if you try to reaffirm that everything is fine and like you said I feel like when you get sick the mouth is such a place where you get sick and you have a cavity and all hell breaks loose because it just everything else starts
It
falling
affects everything.
apart. Yeah.
Yep.
Yeah. So I just wanted from your like professional standpoint, how do we ease those worries and because we've seen even children with, I mean, horrible cavities and that is really sad because now we can help them, but they're not willing to get that help, you know?
Yeah. A lot of people that have that inner fear, they think, oh, they go to the dentist, they're just going to pull out my teeth.
Mhm.
You know,
Right.
you come in to the dentist and we're personable. We speak to you.
Mhm.
There are no judgments. We have seen the worst of the
So,
worst inside someone's mouth. And no one is there to judge you. We're there to help you. And
okay.
that's how every office should be. And if they're judged at an office, get up and leave.
Then that's not where
Yeah,
they
if the
belong.
office is
Yeah.
not clean, get up and leave.
Yeah. Okay.
You know what I like
Thank
to
you.
say to them? I like to say, I have sat in your chair, you know.
Mhm.
I
Yeah. Yeah,
have
I
sat in
know.
your chair.
And you know, like I feel like such a hypocrite because I'm like I'm so deathly afraid of dentists, and then I'm trying to tell someone, "Oh no, you're fine, you'll be fine." And then I have someone telling me that, right? Like Suli is one of them that would say, "Priscilla, just remember you have to go." And so, I think it's a work in progress for all of us, really, when it comes to
Yeah.
that. Yeah,
You
but
Sure.
thank
know,
you.
the other thing you could say to them is, you know, it's you can sit here and you can learn that
Hmm.
when you use a mirror and you touch the tartar on someone's teeth and you tell them, you see this does not belong there,
Yeah.
and you see how this stuff that's sitting on your teeth, you see how the gum looks, it's so fire red and mean
Hmm.
looking. it shouldn't look like that. It should look more like this over here. This is
Okay.
nice and pink. This is an
Yeah.
opportunity to teach them, to
Right.
connect, to
Okay.
tell them, if you do just a few of these things every day, none of that'll be there anymore. And
Right.
when you
Yeah.
come back, it's you have to ease their fears and
Baby
tell
steps.
them,
Yeah.
look, it
Yeah.
looks like this today, but it's gonna look better once you go through this and you do all this and that for yourself. It's gonna change.
Yeah.
Mhm.
Okay. Yeah. No, and I think it's a process. I mean, with everything, right? I mean,
Yep.
health wise, and I do know for a fact that when you have problems with your mouth, any type of it just ruins everything else.
It does.
An infection of some sort, or anything really. But yeah, no, I appreciate your guys' comments and opinions. Thank you so much.
You're welcome.
And that first visit, once you get through that first visit,
I
that's
know
it.
it.
It's easy.
Yeah.
I'm like
No,
that.
it's
Easy.
I'm like, can I go back to the pediatric dentist and have like the TV and the glasses and the
right.
little
That's
thing that they
right.
put?
Yeah. No,
Yeah,
we get
but
into the chair and we sweat too. Trust me.
I can imagine. I feel like it's almost like a responsibility that you guys put on yourselves, right? To have
Yes.
to yeah, no, I can see that. Oh, they have dental spas?
Dental spas. Oh wow, I did not
Huh.
know that.
Certain some places that I think there was one place in California. I have a friend that's a hygienist, and she says, oh yeah, they do their teeth, and then they do their pedicure while they're there. I was like, really?
What?
And they have a TV on the
Oh
ceiling.
my
I was like,
gosh,
Well, this is
no.
more of they make it a more calming place, so it's not necessarily a spa
Oh.
in terms of that, but they do
Well,
give you the 3D, I forget what they're called, like they can put you in a different place with the glasses,
oh, I
and
see.
they have the
Well,
chairs that recline all the way back, and
I
they
kicked the
have
dentist.
Wow.
like the
I
chapels or whatever on the ceilings. I used to go to
yeah.
one. Um,
That's awesome.
I love that.
Yeah.
I'm sure there are plenty of places like that, but you'll pay for them though.
Oh,
Oh,
most
yeah.
definitely. Yeah. Yeah.
Oh, absolutely. They definitely cater to cowards or people who need something like that. I was lucky. My insurance covered it. The
Wow,
old
good for
insurance
you.
years ago. I go to a regular dentist now. I'm actually looking for a new one. So thanks for this reminder, you all.
Yeah. Thank you. I appreciate
Anytime.
it.
I love it. Patty, do you think we should go ahead with the wrap? I can hear you, Patty.
They're going to be two prices, right? One being, I don't know if you can see it. That's why I was asking between the water pick and the floors. So I might send a little floors there with this. So the first one is going to be a portable water flosser. So go ahead, Carla.
Okay, let me share our screen. Give me a second. Can you see my screen?
Yes.
You see the
No, we don't see the wheel.
okay, let me see.
It's probably still loading.
Yeah. What about now?
No. Oh yeah.
You can see it?
Yes.
Okay, so are we ready?
Yes.
Let's go. I have everyone there, right? I didn't miss anyone?
I think you have it.
Okay, let's do this.
Yvette!
Yvette!
Yvette, how did you beat me? It almost landed on my name, girl.
Okay, so now let me understand correctly. Okay, so this is a water flosser, but I still need to do that glide floss.
Yes,
also.
you do.
I'll send it to
ma'am.
you.
Yes.
I'll send
This
it
is
to you.
in addition to.
Okay.
In
Okay.
addition to.
I'll send you the
Thank
flosser.
you. Thank you.
Okay, so can we take Yvette's name out?
Yes.
That water flosser, when you use it, make sure you use it on the lowest speed because they can
Okay.
be aggressive.
Oh,
Ooh.
thank you.
Oh,
Yes.
nice to know.
Yes.
Are
Next
we
is
ready?
a, can you see it? It's
Green
an
screen.
electric toothbrush. Electric toothbrush.
Okay.
Okay.
Let's go.
And we might send you a flosser too. Marcella!
Marcela. You were so close to me. How much? Congrats, Marcela.
Congratulations.
Yay.
Woo.
Is she here, Marcella?
Yeah.
Yeah.
I
Oh, okay.
almost won twice.
Almost. You were this close.
Tamika.
Okay.
Marcella, yes.
Okay. That was fun.
That was fun. So I want to respect your time. So I just want to thank Rose and Myra for bringing such knowledge and so much experience to us all in this community. I mean, the information you gave us was amazing. I mean, I hope everybody learned a little something,
Yes.
right? And we thank you for giving us your time, your expertise, your knowledge. It's almost a century of experience that you bring together. And we love you. And Rose, keep strong. I know
Always.
you're thriving, you're fighting, and our prayers are with you always.
Thank
Martha,
you.
thank you so much. Carla, you're the best moderator.
Tan linda. No, Rose and
Thank
Myra,
you.
thank
Thank
you
you.
so much. We're so
Marcella.
grateful
Oh my
for your
God.
time.
You're
This was
welcome.
And
very informative.
congratulations to the
Happy to
winner.
be here.
Congratulations.
Thank you, everyone. It
Tamika,
was
you want to say
wonderful.
anything? You want to say anything, Tamika? No.
Just that you all are great and this has been wonderful and I really enjoyed it. Thank you all so very much.
Thank you. Thank you,
Thank
everybody.
Jayden, you want to say anything?
Let me see
JJ.
him. Let me see him. Thank you, Morgan. Thank you. Thank you,
Thank
everybody, for
you.
coming.
Thank
Thank
you.
you. Have a good
And
night,
Thank
everybody.
you for having
good
me.
night,
Thank you.
everyone.
Good
Thank you. Good
night.
night.
Well, good
Thank you so
night.
much.
Take
Bye.
care, everyone. Bye-bye.